everyone. Next slide, please. We had a problem. 10 years of handwritten patient records scanned onto a database that was, well, let's call it challenging. We had 10 years of, doctors' handwritings. And I'll tell you right now, if everyone wrote like me, you would need a Rosetta Stone to make any progress. But it wasn't just about deciphering scribbles, it was about the data. Vital patient information was buried, hidden in a haystack of needles. And to make matters worse, this haystack was in the dark. Then came a solution. We developed a smart AI tool that could untangle the mess. It didn't just offer the promise of saving the data, it promised to save hundreds of hours of work. And to be perfectly honest, it did save my sanity. That moment showed me something profound, the value of AI in medicine. But it also opened the door to something deeper, a conversation we need to have about what AI can do and what it shouldn't. Today, I want to share that with you, the promise, the pitfalls, and the ethical questions that demand our attention. Because AI doesn't just represent a new tool, it represents a new relationship between man, machine, and medicine. I see the value of AI in medicine. I'd like to share this with you, as well as some ethical concerns. Next slide, please. So thank you so much for having me. My name is Dr. Temitayo Bewaji. For almost 2 decades, I've worked at the intersection of clinical care, healthcare delivery, technology, and strategy, asking how can innovation make healthcare better for humans? AI has the potential to bring extraordinary advancements, but with them come new ethical questions. How do we protect the interests of patients and practitioners? I know I'm not worried about AI doctors telling us turn patients off and on again. I'm talking about real challenges and real opportunities. Today, I will discuss three key aspects: the promise of AI in healthcare, the ethical considerations we must address, and how we can responsibly integrate artificial intelligence into our practices. So let's explore them together. Next slide, please. Let me share a story from a colleague that might resonate with many of you. So, a few months ago, she sat at her desk, buried under a mountain of paperwork, patient charts, insurance forms, and lab results piling up faster than she could process them. After hours of juggling back to back appointments and endless documentation, she walked into her next patient's room feeling like a data entry clerk, more like a data entry clerk than a doctor. So she tried to focus on the patient sitting before her, but her mind kept drifting to the forms waiting to be filled out. She caught herself glancing at the clock, calculating how much time she had to spend before rushing to the next appointment. And the look in her patient's eyes, resigned and weary, said it all. That day, she felt the connection that drew her to medicine slipping away. Then came AI. So her clinic implemented an AI powered documentation tool that transcribed and summarized patient conversations in real time. Suddenly, the paperwork no longer seemed insurmountable. With AI handling that administrative load, she found herself able to sit with her patients, ask deeper questions, and truly listen. So she told me she was afraid that AI would have replaced her, but it hasn't replaced her. It's empowered her. It's given her back the time to be the doctor she always wanted to be. So that story reminds me of the words of another doctor in the States, a Dr. Michelle Thompson, an integrative care physician. She said AI has allowed her as a physician to be 100% present for her patients. Now take a moment to sit with that. 100% present. Not split between the patient in the room and the chart on the screen. Not juggling a thousand clicks and keystrokes while trying to meet someone's eyes, but fully present. This isn't the promise of some distant future. This is today's reality. AI is already saving us time, shouldering the burdens that once took us away from what matters most, the human connection. It organizes the chaos, processes the mountains of data. It frees our hands so we can use them to comfort, to diagnose, and to heal. And in doing so, it does something profound. It makes human doctors more human. Next slide, please. So, artificial intelligence is like teaching a computer to learn a little like a human. It's a way of making machines smart so they could solve problems, learn from experience, aka data, and even make decisions just like humans do, but without emotions or creativity, which is a significant weakness there. AI mimics human cognitive functions, analyzing information, spotting patterns, making predictions, and offering recommendations. It processes vast amounts of data, learning over time to improve accuracy and enhance healthcare delivery. So think of it like Spotify learning your favorite songs, but with less embarrassment and more life-saving potential. It starts with data collection, electronic health records, lab results, medical imaging, patient histories, wearables, even genetic information. AI can bring it all together, creating a comprehensive view of a patient's health, even uncovering what is hidden. Then the processing begins. Machine learning is simply when computers use statistical models and algorithms to learn from data. Machine learning analyzes patterns like blood pressure, cholesterol to assess cardiovascular risk, applications like that. And then deep learning is an advanced subset of machine learning. It uses layered neural networks like the brain, just like the brain does, to analyze complex data like X-rays, MRIs, spotting abnormalities early and bringing them to the attention of providers. Data enters through the neural network at one end and passes through many layers of what they call neurons until it comes out the other end, a prediction. Large language models, which underpin popular tools like ChatGPT, are a type of deep learning. And deep learning is just like, you're peeling an onion layer by layer, but without, the tears and the irritation. Finally, AI translates analysis into action. It can support real-time decision making, letting healthcare teams intervene before problems escalate. It optimizes workflows from scheduling appointments to predicting staffing needs. Next slide, please. Think of it as a data-driven assistant, one that never takes a tea break or comes to work and immediately goes to lunch or calls in sick. So AI doesn't replace clinical expertise or the human touch or the people in the office, but it amplifies their effectiveness. So the result is care that is better, faster, and more personal. But a caveat here, yes, the technology is advancing quickly, but we must remember healthcare implementation and adoption is still in its early stages. Not only are the capabilities changing rapidly, we're figuring out how to integrate AI ethically and in compliance. So it's already making a difference in administration, yet clinical use is still emerging much more slowly, and rightfully so. We have to be careful when it comes to decision making and patient care. Next slide, please. Foundational research in healthcare goes back all the way to the 1950s. For instance, statistical methods using something called perceptrons, a prime, if you will, Transformers reference there. AI's journey, though, in application really took off in the 1970s uh, with mycin, an expert system that was designed to diagnose bacterial infections and recommend treatments. It wasn't perfect, far from it, but it proved a point. AI had potential as a diagnostic tool, even if the technology hadn't caught up yet. In the 1980s and 1990s, researchers expanded on these foundations, with systems like the Present Illness Program. These knowledge-based models supported internal medicine diagnoses, narrowly focused but laying the groundwork for what was to come. So by the early 2000s, the game flipped again. Patient data went digital with the rise of EHRs. Suddenly, vast data sets were available to feed AI. Predictive analytics and personalized medicine began to take shape. Machine learning algorithms started analyzing patient histories, spotting patterns those static systems never could. Then came the 2010s and IBM Watson Health, a milestone in AI's evolution. Watson promised to revolutionize cancer care by processing medical literature, clinical data, and patient histories. Though its implementation faced challenges, as has always been, Watson showed the power of cognitive computing, artificial intelligence that could understand language and analyze unstructured data like clinical notes. Around the same time, deep learning emerged, transforming medical imaging. So those multi-layered neural networks that we spoke about, those neurons in thousands of layers, enabled artificial intelligence to analyze images, X-rays, MRIs, and retinal scans with astonishing precision. Conditions like tumors, diabetic retinopathy were now being detected at levels rivaling human specialists. AI could read thousands of images without fatigue and in a short period, bringing critical findings to the attention of the specialist. The late 2010s and early 2020s saw natural language processing and large language models reshape workflows. The leveraging of transformers in tools like ChatGPT really thrust AI into the public eye. These tools streamlined documentation, summarized patient records, and supported clinicians in ways unimaginable just a decade earlier. The COVID-19 pandemic accelerated adoption even further. As unfortunate as it was, AI tracked the virus, allocated resources, and supported vaccine development, cementing its role in public health. We may be familiar with applications of AI in medicine currently that we may not associate with AI. So, widely used scoring algorithms like the 10-year cardiovascular risk calculator are examples of tools developed from early AI models adapted for use in practice. Remember, AI is about learning from data to make decisions, make predictions, make recommendations, right? So, and today, AI is ushering in an era of precision medicine and predictive analytics. It analyzes genetics, lifestyle, and medical data to help clinicians craft personalized treatments. Wearable devices and remote monitoring empower patients to take control of their health, seamlessly bridging clinical care and self-care. From Myston to today's wearable tech, AI's story in healthcare is one of relentless progress. So the question isn't if AI will reshape healthcare, it's how we will manage its impact responsibly. And while AI cannot yet cure our anxiety about change, it's taking us closer to a future where healthcare is proactive, precise, and deeply human. Next slide, please. Think of AI as a high definition screen for healthcare. Just as HD reveals the finer details in an image, AI uncovers nuances in patient data we might never have noticed. It doesn't overshadow the human touch, it enhances it. But just like HD can expose flaws, imagine your face on the big screen, AI also highlights biases and privacy issues demanding our attention and care. When we see our patients more fully, when AI is taking over that mundane administrative role, we can engage with patients more fully. We can bring greater compassion and precision to their care. AI sharpens our lenses, but it's still our eyes doing the seeing. A prominent commentator, Dr. Eric Topol, reminds us that AI offers more than efficiency. It connects, it reconnects doctors and patients. It's not just a tool, it's a bridge to a better connection, a bridge to better care. But bridges also raise questions. What are we building towards? How do we ensure that technology supports ethics, not overshadows it? As healthcare professionals, we must accept AI, not blindly, but thoughtfully. And we must ask the critical question, what is the ethical future for man and machine in healthcare? At the end of this presentation, you should have an idea of the ethical pitfalls to guard against when selecting AI tools for your practice, for your organization. Next slide, please. Just showing here an illustration of what AI can be on the right. Ignore the image on the left. We're not going there. But if you notice on the right, just humans in the room, not even a computer. AI is working in the background, supporting everyone. So this new technology, if applied correctly, could actually remove all the screens and all the noises and all the beeps that separate us from our patients. Next slide, please. So imagine this. A father of three, struggling to manage his diabetes, sits across from you. For the first time, he opens up about how his health challenges make him feel like he's failing his family. Normally, you might have missed the depth of that confession, too busy recording his symptoms and lab results. But with AI handling the documentation, you're fully present. You see him not just as a patient, but as a person navigating profound challenges. Instead of simply addressing his blood sugar levels, you start to talk about the steps he can take to rebuild his confidence for himself and his family. And that is what AI offers us, the gift of presence, taking all of the other administrative and mundane and routine tasks away so that we can focus on being present with our patients. So it's not about replacing our judgment, but about amplifying our humanity. AI lets us put the pen down permanently and reconnect with what matters most, our patients. Next slide, please. Let me elaborate. AI brings three transformative advantages to healthcare: efficiency, reduced error, mostly reduction of those errors of omission, that things that we miss, and humanity. Efficiency is evident in how AI automates administrative tasks, documentation, scheduling, billing, streamlining workflows. Uh, this gives providers more time to focus on patient care, especially for complex cases. AI also accelerates processes like medical imaging, identifying critical issues, bringing them to the attention of radiologists so that they could focus on those cases that need their intervention. AI also reduces human error by analyzing vast data sets, spotting patterns that might otherwise go unnoticed. It supports clinical decisions with data-driven insights. AI makes healthcare more human, enabling physicians and others to delegate routine tasks to machines and focus on that human connection. So, by making healthcare more agile and personal, AI supports clinicians and institutions while improving patient experiences. Next slide, please. So, we've seen what AI can do in other industries. In logistics, it optimizes routes and manages inventory. In finance, it offers data driven insights to make smarter decisions. Healthcare is poised to learn from these successes, streamlining workflows, personalizing care, predicting patient needs. But we must also heed the lessons that those industries have learned. Just as AI in finance has been scrutinized for bias, healthcare must also seek to hold itself to the highest ethical standards, ensuring that AI serves everyone equitably. Next slide, please. So, what is the relationship between AI and ethics in primary care? What does AI really mean for patients and practitioners? So, in this section, I'll illustrate, some of the benefits, and then we'll dive into the ethical principles that define healthcare: autonomy, non-maleficence, beneficence, and justice, and how AI could reshape them. Because, AI isn't a stethoscope, it's not a new MRI machine or a fancy coffee maker in the lounge. It raises unique ethical questions: data privacy, transparency, bias, and yes, let's address the question head on. Can AI be racist? This is space exploration, the space between AI, ethics, patients, and us. Next slide, please. So ethics in healthcare are as old as medicine itself, deriving from the Hippocratic Oath and even before. They guide every decision, or rather, should guide every decision, helping us to ensure that patients remain at the center of care. But with AI entering the scene, a question arises: is this technology a threat to ethical patient-centered care? Autonomy means respecting patients' rights to make informed choices about their care, but informed consent becomes more complex with AI in the mix. Patients must understand how AI is used in delivering services that affect them. This means that we have to be able to explain it to them. This means that we have to understand it, at least functionally. It should never replace a patient's agency. It must build agency, not diminish it. It should never replace a physician's judgment or a clinician's judgment. It must support that judgment. Beneficence is about acting in the patient's best interest, promoting well being through every decision. So, for AI to meet this standard, it must deliver measurable benefits: faster diagnosis, better treatment options, personalized care plans, right? Measurable benefits. If an AI tool or indeed any technology doesn't enhance patient outcomes, either through increased efficiency or directly affecting patient outcomes, it has failed its purpose. Non-maleficence demands that AI be rigorously tested, validated, and continuously refined. Do no harm. After all, this is the foundation of medical ethics, and it applies just as much to AI. AI systems must be evaluated to prevent harm, whether that's a misdiagnosis or an inaccurate prediction. It ensures AI prioritizes safety, reliability, and trustworthiness. Justice as well means fairness and equity in healthcare. Every patient should receive equal treatment dependent on their condition, regardless of race, socioeconomic status, or location. So for AI, this requires that solutions we use are built on diverse, representative data sets to avoid bias. Algorithms must work equitably for all patients. AI should do more than just support care. Ideally, that HD function should also help us to expose inequalities that are inherent in healthcare and help us close those gaps. So, autonomy, beneficence, non-maleficence, and justice. These principles that form the ethical framework that healthcare must uphold must be present even as the technology evolves. So AI itself has no values. It reflects the values that we give it. By prioritizing ethical values when we engage AI, we can ensure that the technology respects patient choices, improves outcomes, minimizes harm, and delivers fairness. So when you're selecting a tool, it isn't just about innovation. It isn't just about being the most efficient or saving the most money. It's about understanding how these tools impact the ethics of delivering care and reinforcing the core values of medicine. So, next slide, please. AI for skin cancer detection provides a compelling example of both peril and promise in healthcare. This technology is advancing early detection, especially in underserved areas where access to dermatologists could be limited, and primary care physicians or primary care teams have to take on more of the care. It's a powerful step forward, but there's an ethical challenge: bias in the system. AI models rely on large data sets to learn how to identify malignant and benign growths. Yet, these data sets often contain more images of lighter skin tones. When these models then encounter skin lesions on darker skin tones, their accuracy declines. Why? The AI simply has not seen enough examples to make reliable diagnoses, and that gap in training data becomes a gap in care. So this is then more than a technical issue, it's an ethical one. Darker patients face a higher risk of misdiagnosis or missed diagnoses, leading to delays in treatment and worsening health outcomes. The result is not just harm to patients, but indirect harm to the community, because then you have a broader erosion of trust in the healthcare system, in AI technology, especially in communities where that trust is already at a low. Addressing this bias then requires both technical and ethical action. We must develop and select tools where the data set undergirding those tools are diverse and representative of our population. The developers need to design models that account for these variations. And while us, the users, the end users, must regularly audit the performance of AI tools to identify and correct biases. We can't just leave it to run. Equally important is transparency. Patients, especially those from underrepresented groups, must be informed about the capabilities and limitations of AI diagnostic tools where it could affect decision making related to their care. Only with openness can we empower patients to make informed decisions about their care. By tackling these challenges head on, we align with the ethical standard of beneficence, of doing no harm, of justice, right? More than that, we ensure that AI doesn't just work for some, that persons are not left behind as the technology marches on, but that we can all benefit from the wonders of this new technology. Next slide, please. So just to reiterate, AI's benefits in healthcare comes with ethical challenges, issues of accountability, privacy, bias, and issues related to informed consent. Accountability is very important. When AI makes a wrong recommendation, who is responsible? Developers, providers that are implementing those decisions, or institutions that have bought and implemented those tools? Clear guidelines are essential to maintain trust and ensure safety. As well, privacy must be protected. AI relies on sensitive patient data, which is vulnerable to breaches. So, strong governance and anonymization protocols ensure that confidentiality is maintained and there's respect for autonomy. Bias is also a persistent issue. AI trained on limited data sets can replicate inequities and disadvantage certain groups. So those historical inequities in healthcare play out in the data. And when we use that data to train artificial intelligence, those inequities are then magnified and are evident in the output of the applications. So diverse data, as I said, and regular audits are critical to ensuring that the systems remain fair. Informed consent again requires transparency. Patients must understand AI's role in their care, its benefits, its risks, and limitations. So clear communication then builds trust and empowers decision making. When we communicate clearly with the patients, they understand the tools and can use it to also support their own care. So for AI to truly transform healthcare, it must prioritize humanity, ethics, and trust at every stage. Next slide, please. So AI-assisted screening for diabetic retinopathy illustrates its potential and challenges. The good news: AI expands access to early detection. So in rural areas, or not so rural, but specialists are scarce, it identifies disease progression, preventing vision loss. So persons can receive timely care. Cases can be referred in a timely manner to specialists. You can get assistance from specialists so that everyone can focus on those cases that require the most need, most attention. But again, the challenge lies in bias. AI models often lack diverse training data, leading to reduced accuracy for underrepresented groups. So when we're selecting tools, we need to ask the questions, what data was used to train this? And I'll bring this up a little bit later. This raises, the ethical questions about equity and fairness. Addressing this requires, again, diverse data sets, regular audits, transparent communication. It bears repeating. Right? We can't keep AI in the back and pretend that we're not engaged in using it. Informed consent and clinician oversight ensures that AI remains a tool for empowerment, not exclusion. Can't leave AI to run by itself. We have to have a clinician or a decision maker who has oversight of it. With the right approach, then AI can improve outcomes while upholding the core values of fairness and trust. Next slide, please. So picture a single mother juggling two teenagers, a high pressure job, living with hypertension. One night after a stressful day, maybe the one of the teenage daughters brings home a boyfriend. Uh, Her wearable device alerts her that her blood pressure has spiked dangerously high. Within moments, the AI has flagged her doctor, recommended an intervention, and suggested a calming exercise. This is the future we're moving toward, a world where AI works with both the doctor and the patient to safeguard health. But what happens if the AI overcorrects in its recommendations and misinterprets temporary fluctuations? What if that boyfriend was a study partner? Without intentional human oversight, even the best intentions can lead to harm. We must also avoid automation bias. Automation bias is the tendency to defer to AI recommendations. AI is a powerful partner, but it's not infallible. Sometimes when we see those recommendations on the screen, we say, all right, cool, the computer is smart. It has crunched all this data. This is what it's bringing. But we need to avoid suspending our critical judgment, right? Ethical guidelines and human judgment must remain at the center to ensure that this technology empowers without overstepping. As AI grows more autonomous, new challenges arise. Autonomous agents may soon be able to adjust treatments and monitor conditions, hopefully with oversight. Because to ensure safety, human supervision must remain central. We have to balance that efficiency with accountability. Adaptive learning technology allows AI to evolve with new data, but unchecked changes could lead to unintended risks. So you have that AI accepting new data, learning from outcomes, and improving itself, right? But we need to have continuous audits and controlled testing environments to ensure that AI adapts safely. So there's another long-term impact on patient-provider relationships that is of concern. We must not allow the AI to get between us and patients, just like the screens have. AI must complement care, not replace the empathy and the trust that define human connection. Next slide, please. So let's continue with our thinking about an AI system that's monitoring a patient with chronic conditions. It adjusts medication based on real-time data. At first glance, it's perfect, but something is there supporting the patients. Until, again, it misinterprets a short-term fluctuation, creating unintended risks. What if instead of calming exercises, it recommends direct treatment to the patient, double your blood pressure medications? As I said earlier, AI can offer recommendations, but it lacks the human intuition and the creativity. Without oversight, we can have a system that will miss the nuances of a patient's broader context. Therefore, Implementation must mandate, if you're implementing in your system, in your organization, must mandate human review for significant changes. And this is how we preserve the safety and trust. Clear boundaries between AI autonomy and clinician oversight ensure that AI remains a tool for empowerment. Patients need to know that their care decisions are guided by both technology and human expertise. Patients nowadays are not going to be happy if you're using no technology and I guess you're, homing pigeons and stuff like that. But they also want to know that a human is involved in their care, right? So we have to balance uh, the technology and human expertise. The technology should be used to support humanity. When ethics leads innovation, AI becomes then a reliable ally in advancing healthcare. Next slide, please. So building ethical systems then starts with collaboration between developers, healthcare providers, and regulators. So we have to engage with organizations like the Jamaica AI Association, where you can find a lot of persons that are working on AI initiatives right here in Jamaica. Transparency fosters trust. So the providers need that insight into how AI makes decisions, how the data is being used to support the AI, from identifying those anomalies in imaging to recommending treatments. So when clinicians and patients understand AI, confidence grows, right? We need to ensure that we're using diverse data sets to support fairness. AI systems must reflect the diversity of the populations they serve, ensuring that equitable care is provided for all the relevant demographics. Again, regular audits. Don't just leave it to run. Figure out how you're going to find out, if it's making the wrong recommendations, if it's sending all your bills to the wrong persons, or if it's misprocessing your bills, those kind of things. You have to keep an eye on what's going on so that you can correct biases. AI isn't yet fully autonomous, and even when it does get to that point, if it gets to that point, we still need people in the mix to ensure that it's supporting and doing the right thing. Accountability then requires clear rules. Clinicians must remain the ultimate decision makers. So you're not going to allow your MRI scan or all of those things to make the ultimate decision, right? The clinician must remain the ultimate decision maker, using AI just as a support tool rather than a replacement. And we must not underestimate their layer of automation bias. It's very important, right? When you see those recommendations, it's important to consciously and intentionally not suspend your judgment, right? So by embedding all of these things into AI developments, we can create systems. And when I say systems, I don't just mean the technology, I mean social technical systems, the human element, the training, the people, the understanding, right? The processes that support that integration. We can create systems that enhance care while maintaining trust and equity. Next slide, please. Now we're going to talk about the things that none of us like. Regulation, right? They're essential, though, to ensure that AI serves patients ethically and responsibly. We can't hide from AI, it's coming. But just like the developers, we must engage with regulators that make the important decisions. Data privacy laws, like the Jamaica Data Protection Act, seek to protect sensitive patient information. So, things like encryption, anonymization, and consent are non negotiable standards when data is being used for training. Accountability standards in laws must clarify rules, and the developers must adhere to standards, of rigorously testing their models, while providers ensure that those AI recommendations align with clinical expertise. So it's not developers working in a corner, regulators working in a corner, doctors just accepting and using and feeding it to the patient. What's going on? Why does my connection? Oh, come on. What's going on here?
Is now experiencing some technical difficulties.
Hello, I'm back. Let's hope. So I was saying, yeah, I'm back. Let's hope. I was saying that it shouldn't be the developers working in their corner, the doctors just accepting the tools, and the regulators working in their corner. We have to engage, right? This is a time when revolutionary technology is being introduced into our systems. All right, we need to engage. When the EHR was introduced, the techies just developed the tools. Many of them did not have healthcare experience. And we can all see where that led. The difficulties in adoption, the challenges that we all had, the tools that made us feel like data entry clerks, not doctors, right? We're just typists typing on a screen. So engaging at this stage where the technology is still in its formative uh, stage is key to ensuring that the technology serves us and serves the patients. So, you have regulators, FDA working on testing standards, the European Union AI Act talking about fairness, diverse, bias-free training sets. We should be engaged in all of these discussions locally, in as much as the Jamaican government is working on some of these things. I know that there was a task force recently to ensure that the regulations, as they impact healthcare, enforce inclusivity, making sure that AI delivers equitable outcomes for the Jamaican population. So these frameworks must protect patients while fostering innovation. They must keep AI aligned with the values of trust, privacy, and fairness that are central to healthcare. Next slide, please. So today we've explored AI's ability to transform healthcare, enhancing diagnostics, reducing errors, and expanding access while addressing ethical challenges, bias, accountability, issues of consent, uh, privacy. These principles ensure that AI aligns with the core values of fairness, trust, and patient-centered care. And together, they create a roadmap for responsible integration. It's important. AI is not uh, just any other tool. It's a transformative tool. So we need to ensure responsible integration. It can help us provide better, more equitable care, but its success depends on how well we uphold the humanity that drives healthcare. AI's potential is immense, but so is our responsibility to guide the process ethically. So, by embracing this innovation, not hiding in the sand, while safeguarding fairness, privacy, and accountability, we can foster AI systems that enhance care without compromising trust. Collaboration between providers, developers, policymakers, and patients is essential to shape a future where AI supports the values at the heart of healthcare: equity, empathy, integrity, patient centeredness. Next slide, please. So, as our two doctors earlier that I mentioned, Dr. Stoppel and Thompson, remind us, AI doesn't replace the human touch, it should enhance it. By automating those routine tasks, providing precise insights, AI allows us to focus on what matters most: the patient. So when we commit to using AI ethically, not just using a random tool that we found, you cannot throw patient information in ChatGPT, by the way. Um, we prioritize privacy, fairness, and accountability. We can strengthen the bonds that define meaningful care. Next slide, please. But I don't want this conversation to end here. I want you to walk out of this room with something you can use. Let's make it real right now. Number one, educate yourself. Get a functional understanding of AI. Know You don't need to dive into coding, but watch a short demo, watch a YouTube video, read a quick article, or you can grab, a book from Kindle. I have one, search for my name. In the book, what I try to do is to give you a mental framework because I struggled to understand for a while how to situate the different tools and techniques of AI in the healthcare environment. So I try to kind of tease it into a mental framework so you can understand AI in a way that is highly relevant to healthcare. The tools, the techniques, and how they are applied. So, for instance, decision making, drug development, uh, automation of operations, right? All of those things. It helps to understand these concepts just enough so that you could see what AI does and how it might fit into your day. It's like learning to drive before you hit the highway, right? You don't need to become a mechanic first, but you need to know how to get the car from point A to point B safely and responsibly. Number two, brush up on your data protection. AI cannot do its job without data. So review your data sharing and privacy policies. Make sure you understand how AI would interface with the local regulations. In Jamaica, it's the Jamaica Data Protection Act, or HIPAA in the States, right? Protecting patient information isn't optional, it's foundational. So when I consult with practices to help them get compliant with the Data Protection Act, one of the main objectives is to get their data practices in a place where they could safely leverage advanced tools like AI. This is important. Those data practices create a stable foundation for you to now start using your wearables, your artificial intelligence, telemetry, all of those different tools that are available to support patient care. But without proper data practices, and I don't mean just a password or a firewall wall, I mean trained staff that understand data privacy. Um, Without those practices in place, using tools without consideration could cause more harm than good. Also, identify your pain points. Think of the biggest headaches in your daily routine. Repetitive charting. And sorry, just to go back to that point, you don't need to necessarily go through the full process of reorganizing your data practices, but for every tool that you want to integrate, ensure that you have data practices to support at least that tool, right? So, for instance, you're introducing voice dictation, which we touched on earlier. Make sure that uh, your connections are secure, that your consultation rooms are private, all of those additional things, right? Just to support that particular practice. So you identify your pain points. Think of the biggest headaches in your daily routine, your repetitive charting, scheduling chaos, or that uh, 10 shells of paperwork that you need to attend to. AI isn't just a cool gadget. It's here to help with real problems. So pick one or two of those tasks where you lose time and where you lose focus. Start small, all right? You don't have to rebuild the entire practice overnight. As I said, start where you need the most help. Begin with a simple pilot project so you could see results without flipping your workflow upside down. If you notice, I'm not recommending specific products or specific tools because the technology is changing very quickly. A few months ago, we didn't know we'd be here where we are today in AI technology, right? So the point is to understand the basics, understand the foundations, so that whatever tools come, you can actually implement and engage. But remember, transformation happens in steps, not leaps. Also, involve your team. Don't go it alone. You gather your nurses, admin staff, or that one person, that one colleague who's always trying all the new tech, right? Ask for their thoughts. What would help them? What would make their day better? If you want AI to thrive, let your practice embrace it together. A quick story. I once implemented AI retinal scanning in a primary care setting. Our first questions were, which population was this data trained on? Would it be accurate for our patients? We discovered that the tool was built mostly from data drawn, well, it was built on data drawn from an Asian population. Clearly, this raised red flags for our Caribbean community. We had to ask, What can we use this for and what can't we? Should we use it? How can we explain any findings to patients? Do we even move forward? We engaged with the doctors, the nurses, patients, and did a controlled pilot to figure out a workflow that made sense. The tool itself was highly accessible. Once you start looking, you realize how accessible these tools can be. You don't need $1 million. But the real challenge was integrating it responsibly and effectively into our practice. This clearly required a team effort, right? If you don't do anything else, you could try AI-powered dictation. Many EHR systems already have AI dictation, and if they don't, they'll be having it in the next few months. Or you could grab a data compliance tool. I would advise a HIPAA compliant or a GDPR compliant tool. Test it on one patient note. So HIPAA, again, is the American standards. GDPR is the European standards. The Jamaica Data Protection Act is built on the principles of the GDPR. So you test it on one patient note, see how it frees you from the keyboard, how it feels to look the patients in the eye again. We're not talking about turning you into a tech wizard. It's about reclaiming your time, your energy, and your connection with the people that need you the most. So AI can help with that today. You don't need to wait for the next breakthrough. Enough tools are ready. The question is, are we? Go and try it. Open up your EHR, check your settings, turn on that dictation feature, and see what happens. It just might save your sanity too. With responsibility and collaboration, AI can help us build a healthier, more connected future. Together, we can ensure technology uplifts humanity at the core of medicine. Thank you.